Okay, so I'm going to just kind of show you the technique, and then you can use this for any body part. If you're having tight calves, I would treat the feet and the calves and the shin. Technically, I think it's best to treat the lower body from your hip flexors and glutes all the way down. 3 days a week is really, really good because as you do trigger point release, you can actually make progress and get more and more mobility as you do it. And then you also recover faster from your workouts because you're not stiff for a long time, but you get your mobility back faster. So I would do it more than what we're going to go over, but we'll just kind of do the feet. So I have a lacrosse ball. If you have a golf ball, that's better. And you're going to stand and do it, and you're basically going to do pressure points within the foot. And then when you do that, just make sure, if you can see the bottom of my foot, you don't need to get on the heel bone, but right where it drops off into the arch. And you want to get the medial and the lateral arch and all the way up to the ball of the foot. So when I do it, I just stand and kind of roll. And I usually start at the front, and I kind of find a spot, and I hold it. And there's not a set amount of time. I like to do, I usually like to hold it till it starts to release. So I put enough pressure, depending on how sensitive my foot is. It might be a 5 out of 10 discomfort up to a 7. I'm looking for an amount of discomfort that gets my attention, but I'm not crying. And I've been rolling my feet, so with this lacrosse ball, like I'm not finding anything. I need to get a golf ball to get more pressure. So most people, when they roll trigger points, they find a spot and then they just roll over it back and forth. That's not what you want to do. And so when we get in the calf, you're going to find the trigger point and you're going to hold right on the trigger point, and then you're going to do an active release technique on the trigger point. So you're never rolling off until you're done treating it. So with the foot, it's fine to roll the foot to find the spots that are really sore, but once you find a spot, you actually just want to hang out there for a while and hold pressure. And then you can work your toes up and down, and that's going to move the muscle while you have that trigger point pinned down, and that's called active release. So that's actually what's going to help break up the stiffness in the muscle fibers. And then later, after you do all of your rolling, then you can stretch. So for the calf, if you have a yoga block, I just have this balance block, so I'm just going to use this as a demonstration. But or you can use a foam roller. But really quickly with the ball, you would start near the Achilles, like just above the Achilles, and you're going to scan your entire muscle, the outside, the middle, and the inside of the calf, and you're going to kind of scan it and look for those trigger points. I can't really roll on this thing and scan it. So just to kind of show you for effect, let's say I find a really bad spot. How you're going to release the trigger point is you're going to hold it. You want enough pressure that it's about a 7 out of 10 discomfort. And then once you get that 7 out of 10, go ahead and hold it for like at least 10 seconds. And usually holding it till you start to feel that pain go down. It's not going to go away. It's going to go down. And then once that happens, so wait till that happens. Once that happens, go ahead and do some ankle circles. And I like to do between 5 and 10 repetitions of the active release movement. So depending on how painful it is, if it's really hard, try to get at least 5. If you can, sink deeper into the trigger point if it starts to relax. So by the time you get to 10, you've really sunk in that trigger point and released that stiff tissue. And then you're just working up the calf. So foam rollers the same way. Just grab it. Again, it's fine to roll if you're looking and searching for the trigger points. That's what you should do. You should check the whole calf. But once you find one, then you want to cinch it down, do your 10-second hold, and then you want to do your active release, which for the lower leg is going to be basically just big ankle circles. You can go clockwise, counterclockwise. You might want to release the shin as well. You can use really anything. You can use your hands. You can use one of those roller sticks. I like to use a ball, usually a tennis ball, because it's a little more sensitive. You don't need to roll on the bone. So get in the muscle and search your shin. And you may find some pretty bad points down lower and then up higher. I mean, you can find them anywhere, but I notice people get really tight down in the lower part, and then they usually have a few bad trigger points up here. So check those areas out, treat all the trigger points that you find, and then stretch the area after. And then if you're doing this 3 days a week, you're going to feel a lot more mobility in a short period of time.